Pros and cons between breast implants and fat transfer to the breast. Hello, my name is Omar Tillo. I'm the medical director of Cryo Clinic and body contouring plastic surgeon. I've put together a playlist of breast augmentation videos that I linked in the description. So what's the difference between breast implants and fat transfer to the breast? They're both techniques used to augment the volume in the breast. The first one, using implants, we use a silicone-made prosthesis that we inserted under the breast or under the pectoral muscle to give the volume. In the second, using fat transfer, we use your own fat tissue, take it from somewhere in the body through a liposuction technique, then injecting it under and around the breast tissue to achieve the enhancement desired. So what's the difference in shape between fat transfer to the breast and breast implants? With fat transfer to the breast, you expect to achieve more natural and overall enhancement of the breast. It's usually more difficult to get the fullness on the upper pole. And also the volume is limited with the fat transfer. With the breast implant, we have more control on the volume, so we can go relatively big as the patient desire, and depends on the shape and the volume of the implant, we tend to be able to get more fullness on the upper pole of the breast, which is one of the advantages of using an implant. So what's the difference in recovery between breast implants and fat transfer to the breast? With breast implant, most people recover to their normal day-to-day activities within a week to two, and about 4 to 6 weeks to full physical activities. With the fat transfer to the breast, the recovery depends mostly on the number of liposuction area. So for 1 or 2 small areas of liposuction, the recovery can be about a week to light activities and 3 weeks to go back to full physical activities. With more areas, 4 or 5 areas of liposuction, the recovery can take longer, up to 4 or 6 weeks. So what's the difference in terms of scarring between breast implant and fat transfer to the breast? With breast implants, we have to make an incision which can be about 3 or 4 centimeters in length on the fold underneath the breast, and that leaves a scar which is permanent in that area. Usually it's hidden within the crease. With the fat transfer to the breast, the incision into the breast is much smaller, is about 5 millimeters, also in the crease area, and that leaves a small spot. However, with the fat transfer also, we need to do the liposuction, and the areas where we remove the fat also will have small incisions. Could be on the stomach or the thigh or the back. So what's the difference in terms of the long-term outcome of both fat transfer and the implant? Both procedures, they tend to have long-lasting and permanent outcome. With the implants, you get an instant results. Then over the following few weeks, while the implant is settling in place, there'll be some changes, but then usually within 3 to 6 months, the results is permanent. Obviously, implants at some stage, they tend to need maintenance, may need to be replaced if they rupture or if they form capsular formation. So with implant, you expect that you need more revision surgeries in the future. With the fat transfer, usually the first 3 months, where once the fat is settled down, then the volume becomes permanent. And following that, then the changes are minimal. That means we don't expect that you need to any maintenance surgery in the future, unless you want a bigger volume and you want more fat transfer as a top-up. So how would you determine which procedure is best for you? Depends on your aims and expectations in terms of the volume you want to achieve, how many cup sizes you want to go up. Secondly, the shape of the breast. And lastly, whether you have any deposits of fat tissue in your body which you want to get rid of. You want a significant enhancement in the breast tissue more than a cup size, especially if you don't have pockets of fat tissue which you want to get rid of, then breast implants might be the best option for you. However, if you do have deposits of fat tissue anywhere else on your body, on the abdomen, on the back, or the thighs, you want to get rid of these fat deposits, and at the same time you want a modest enhancement in the breast shape and fullness in the breast up to about a cup size, then fat transfer would be the best option for you.